Do online consultations work for foot pain? Absolutely they do. The question is how well can you describe your issues, and then how well can you articulate, point to where it is that hurts. Just because you might have pain over a large area, it doesn't mean that you necessarily need to not have an online consultation. But what you need to consider is whether or not you can give me the information that I need. So when I do an online consultation, the devil is in the detail. I will ask lots and lots and lots of questions, and I want to know exactly where it is that hurts, because when I look at the foot, I can kind of use my anatomical knowledge to give me a rough idea of what's in that area, and then I know how long it's been going on from what you've told me, and then I use the characteristics of the symptoms that you have. What does it feel like? If I know what it feels like for you, I've got a much better idea of what kind of structure it is that's injured. Because nerves, they'll have burning or electric or numbness type pains, whilst tendons will have deep aches or sharp pains, and they're normally very, very localized, and they'll have pain that sort of comes on after having been at rest for a little while. It's known as post-static dyskinesia. So all of this information gives me all the clues that I need to know exactly what it is that's giving you grief. I'll ask things like, is it localized to one spot, or does it spread out over a large area? When it's in one spot, then I've got a good idea that it's going to be something like a muscle or a tendon. If it spreads out to a larger area, normally I'm thinking, could be a nerve, or could be nerve related, could be something pressing on a nerve. When I then talk to you about associations and things like that, it's what other structures are hurting. Because sometimes when one thing hurts, another thing hurts. For example, with knee pain, it's not unusual to get pain on the inside of the knee, medial knee pain, and that to have come from the hip. Likewise, if you're getting pain going down the back of your leg, then it might be coming from your back, or it might be coming from muscles around your bottom. So things like the piriformis muscle can compress the sciatic nerve. We look at the time, so when is it that it hurts? Because different things hurt more at different times. A bone stress injury hurts more during activity that would irritate it, whilst tendon issues, they tend to hurt more after rest. They'll hurt a little bit during activity, and they might hurt a bit more after activity, but they also hurt more after you've been resting and you first get up. I like to know what helps as well. Whether you've taken painkillers, if the painkillers have eased the pain, not done anything with it, because that also gives me a much better idea of what the nature of the injury is. Is it something that's actually responding to anti-inflammatories and doing well with those? Or is it something that isn't responding to anti-inflammatories, so might be related to other issues? Could it be coming from elsewhere in your body? And I like to know what the pain levels are. Just because it hurts you a lot doesn't mean it's a severe issue, and likewise, just because it's not hurting you much doesn't mean it's not something I won't take seriously. It's just a question of looking for where you're at. Because also, if I put in place a treatment and then you say, well, my morning pain is better but my evening pain is still there, then I know that possibly one of the things that I've treated has gone away while something else is hanging around and still causing grief. So there we go.